Today we're discussing physical and chemical sunscreens. Alright guys, welcome back to the channel. I'm sat here again today with Dr Euan and Dr Kish, and we're going to be talking about different types of sunscreen. Now this is a very hot topic for you, my friend.
I think it's a hot topic for our patients, the people who are having injectable treatments. They kind of ask us, like, what do you use on your skin? How do you keep things looking fresh?
How do you look so amazing all the time?
I mean, that might happen to you, but you know.
Actually 107.
Yeah, 108 actually.
108.
Yes. I think one of the best advice we can give is to use a sunscreen every day on your face at least. Obviously we want some vitamin D, so you might not choose to cover every day, but a good sunscreen is a really good insurance to prevent against photoaging.
Kish, seeing as this is your special topic of knowledge, what is the difference for people at home that don't know about chemical sunscreens or physical sunscreens or don't know anything about that?
Okay, so first off the bat, I'd say we are going to generally be recommending you wear physical sunscreens. So physical sunscreens are made out of mineral oxides such as titanium oxide and zinc oxide. And what they do, they're fairly large reflective particles that in a really nice formulation, they'll sit on the surface of your skin and they'll reflect and scatter the UV radiation off your face. So it's like a guard, a shield reflecting away the damaging rays of the sun. The chemical sunscreens are a little bit different. They contain much smaller particles which penetrate the skin. And actually there's been studies to show that you can find these particles in the blood and in the urine. So they have sort of further reaching effects. And also they have been linked to certain forms of DNA damage and also disruption of hormones. So for example, if you have a lady whose estrogen metabolism is not very good, these type of sunscreens can adversely affect your estrogen metabolism, and that has really far-reaching effects. However, the physical sunscreens don't really have that as a side effect or an issue. So I suppose my feeling is, however small the risk is, if we've got a good product which we can actually recommend our patients, that's the one I'm going to really, I suppose, swerve to. And the products that we generally send to you from the lovely clinic have got not just the physical sunscreen element, but they have antioxidants like silmarin, like vitamin C, and really potent quantities of those antioxidants. And they also have a very good cosmetic elegance as well. So when you rub them on the skin, once they're rubbed in properly, they don't have that white greyish cast, which is really typical of most of the sunscreens you see out there. So with this type of shield or sort of veil over your face, you end up protecting your skin from the damaging effects of the sun much more effectively.
So what product are you talking about there?
So we've got, in terms of a product that ticks all of the boxes, we've got products called Illumier, and the products in that range are a very sheer, sort of colour-free finish. We've got products which are ideal for oily skins. They have like a matte finish once they've been rubbed in properly. And then finally, we've got this universal tint product. So you apply it and it seems to match all skin tones.
I think Euan is wearing one of those right now.
So I've got Illumier on today. I've got the Moisture Matte, which is the one that's mattifying because I'm quite shiny. So I know. So.
Not today.
Well, a bit. Anyways, so it's got a very slight tint in it because I knew we were filming today, so it doesn't look like I'm wearing anything on my skin, but it just kind of makes my complexion a little warmer, so I guess it's my favourite one in the range.
What do you use?
So I'm using not Moisture Matte, but I'm using the universal tint because my skin's a little bit drier, but it just seems to work really well on me.
Are you using it with the tint then?
It's got the
hydration.
Yeah, exactly.
With the tint. Yeah.
So that's also got vitamin E, vitamin C, a bunch of other antioxidants, and it's really cool because when you rub it onto the skin, the antioxidants get released.
Have you tried the untinted version?
Yeah.
What do you think?
So that leaves my skin a little bit more grey. If I'm honest, it leaves it a little bit more greyish.
I didn't like that.
So it doesn't suit me at all. But you just have to find out what works for you. And you can try them. When you come to the clinic, you can try these products and just see if they work well for your skin. Because if we're doing the hard work, and if you're doing the hard work of coming in and having injectable treatments, it's a good way to protect your skin and your face from aging further, at least from the effects of the sun and environmental toxins.
Cool.
When do you think, because you've been so quiet,
Mm.
when do you, which is uncharacteristically weird, when do you think people should start wearing sunscreen?
I guess from when they get up, really.
Boom, boom.
What age do you think people should start wearing sunscreen
I'm
from?
sorry. Great question. I mean, even when you're a kid, I think, even children. Because,
Every day?
Yeah.
Yeah.
Yeah. Even, oh, did I get the right answer?
I think so. But I don't remember it being a thing when I was younger.
No.
No, but babies, when you take babies on holiday now, you do cover them up with these thick barrier sunscreen creams, don't you? And children certainly, yeah.
I didn't go to school though wearing SPF or anything,
No.
but most of your sun damage happens in childhood, doesn't
Yeah.
it? And then you have all these detrimental effects further down the line, so I don't see any harm.
Yeah.
I think it wasn't a proper holiday when I was a kid unless you came back peeling.
Blisters.
Yeah,
A
everywhere.
successful holiday with
Yeah.
your children in agonising pain.
We laugh now, cry later.
Cry later.
Yeah.
We'll see the leather later.
If your makeup has got an SPF in it, great, that's fantastic. But I would also suggest that you use a separate SPF as well, because it's not going to give you enough protection just having it in your moisturiser or in your foundation. You can layer them. Like, you could have an SPF and then put your makeup on over the top, and then use a makeup setting spray that also has an SPF in it as well, just for that like triple protection, which I do sometimes when I go on holiday. But just having it there on its own is probably not sufficient.
Thanks, guys. Hope you enjoyed that little video about sun protection, how to protect your face for the future. We'll be back very soon with another topic in aesthetic medicine. Any questions, comments, ask them in the section below. We'll see you very soon. Bye-bye for now.